look inside your heart and I look inside mine. Things look so bad everywhere. In this whole world, what is fair? We walk the line and try to see, falling behind what could be. Oh, oh, bring me a higher love. Bring me a higher love. Oh, bring me a higher love. Where's that higher love? I keep thinking of. Bring me higher love. Bring me higher love. Oh, bring me higher love. Bring me higher love. Worlds are turning, and we're just hanging on, facing our fear and standing out there alone. I yearning, yeah, and it's real to me. There must be someone who's feeling for me. Things look so bad everywhere. In this whole world, what is fair? We walk the line and try to see, falling behind and what could be. Oh, bring me a higher love, my Lord. Bring me a higher love. Oh, oh, bring me a higher love, my Lord. It's that higher love I keep thinking of. Bring me higher love. Bring me higher love. Oh, bring me higher love. Bring me higher love. Oh, bring me love. We need a higher love. Bring me, yeah, a higher love. I'm thinking of. Bring me higher love. Bring me higher love. Bring me higher love. A higher love. I keep thinking of. Bring me a higher love. Bring me a higher love. Oh.
I think it's safe to say that you will always change. New colors day to day, my friends, you are a hurricane. The look on your face, all the things you say, send me to outer space. My friend, you test my patience, don't you just push me out now. You got me into this mess, who's gonna get me out? Why are you pulling me down? If you got things to figure out. Oh, you're not ready for me. Oh, you're not ready for me. Yeah. Go steady on your heavy heart until you're free, until you're ready for me, until you're ready for me. Why do I care so much about you, boy? You know I do. I think a million thoughts, but only half get through to you. You start a million fires just to see what they can do, but then you freeze up like winter season in June. I wanna climb into your mind and turn on all the lights, but all your secrets, see if you wonder about mine. We're just kids trying to understand the world. You're still only a boy who's scared of a good girl. Oh, you're not ready for it. me into this mess? Who's gonna get me out? Why are you pulling me down? If you got things to figure out, oh, you're not ready for me. Ready for me, no, no. Oh, you're not ready for me. Ready for me, no, no, no. Go steady on, going heavy heart, until you're free, until you're ready for me, until you're ready for me.
Honeybee, could you imagine where our lives would lead? That silly ring, it wasn't meant to be. Luckily, I saw in me something I couldn't see. Honeybee, I can't imagine how my life would be if all your gravity did not hit me. Oh, don't you see, darling, my honeybee. But here we are, after all the misses and confessions to the stars, that we never really owned as ours. And if our world comes tumbling down, I never could forgive myself for leaving out. You're the one, you are the only one. Such a fool, I took your love and I bent all the rules. You took the blow and didn't let it show. Stuck around to let me know. Built a family of our own. Look around, we made a garden of the love we found. So many reasons I would fight to stay. You're the courage when I fade. Take a look at what we've made. But here we are, after all the misses and confessions to the scars that we never really owned as ours. And if our world comes tumbling down, I never could forgive myself for leaving out. You're the one, you are the only one. Won't you decide? Won't you decide? I want you to soar. Don't doubt anymore. Little by little we meet 'em. Won't you decide? Won't you decide? I hope you can hear me, I needed you. I want you to save my life. Don't doubt
Let's
anymore.
keep this between you and I.
And if our world comes tumbling down, I never could forgive myself for leaving out. And if our world comes tumbling down, I never could forgive myself for leaving out. You're the one, you are the only one. And if our world comes tumbling down, I never could forgive myself for leaving out. You're the one, you are the only one.
Take a seat, right over there, sat on the stairs, stay or leave. The cabinets are bare and I'm unaware of just how we got into this mess. Got so aggressive, I know we meant all good intentions. So pull me closer, why don't you pull me close? Why don't you come on over? I can't just let you go. Oh baby, why don't you just meet me in the middle? I'm losing my mind just a little. So why don't you just meet me in the middle? In the middle. Baby, why don't you just meet me in the middle? I'm losing my mind just a little. So kitchen floors are wet, and taps are still running, dishes are broken. How did we get into this mess? Got so aggressive. I know we meant all good intentions. So pull me closer. Why don't you pull me close? Why don't you come on over? I can't just let you go. Oh, baby, why don't you just meet me in the middle? I'm losing my mind just a little. So why don't you just meet me in the middle? In the middle. Looking at you, I can't lie. Just pouring out admission, regardless of my objection. Oh, and it's not about my pride. I need you on my skin, just come over, pull me in, just. Oh, baby, why don't you just meet me in the middle? I'm losing my mind just a little. So why don't you just meet me in the middle? In the middle, no, baby. Why don't you just meet me in the middle? Oh, yeah. I'm losing my mind just a little. So why don't you just meet me in the middle? Oh, in the middle, baby. Why don't you just meet me in the middle, baby? I'm losing my mind just a little. So why don't you just meet me in the middle, middle, in the middle, middle?
Before you came, I jumped the gun. I'd get so far ahead that I couldn't stop. Too many times I should have run. I tell myself it's real, but it never was. All of those mistakes I made over and over, they were meant to guide my way closer. Yeah, I think I finally got it right with you. It took a minute, but I always knew. If I never got it wrong, I never would have seen the truth. I think I finally got it right with you. I searched the world so high and low, but never really knew what I'm looking for. I see a light and chase the glow, but everything that shines isn't always gold. All of those mistakes I made over and over, they were meant to guide my way closer. Yeah, I think I finally got it right with you. It took a minute, but I always knew. If I never got it wrong, I never would have seen the truth. I think I finally got it right with you. I give it up, giving up on finding love. But it was you that I kept on dreaming of. And once I knew that feeling, I couldn't go wrong. I think I finally got it right with you. Ah, I think I finally got it right with you. Ah, I think I finally got it right with you. I finally got it right with you. It took a minute, but I always knew. If I never got it wrong, I never would have seen the truth. I think I finally got it right with you. Yeah, I finally got it right with you. Hey, I finally got it right
See the curtains hanging in the window in the evening on a Friday night. Little light is shining through the window, lets me know everything's alright. Summer breeze makes me feel fine, blowing through the jasmine in my mind. Summer breeze makes me feel fine, blowing through the jasmine in my mind. See the paper laying on the sidewalk, a little music from the house next door. So I walked on up to the doorstep, through the screen and across the floor. Summer breeze makes me feel fine, blowing through the jasmine in my mind. Summer breeze makes me feel fine, blowing through the jasmine in my mind. Sweet days of summer, the jasmine's in bloom. July is dressed up and playing her tune, and I come home from a hard day's work, and you're waiting there while caring the world. See the smile waiting in the kitchen, food cooking in the plates for two. Feel the arms that reach out to hold me in the evening when the day is through. Summer breeze makes me feel fine, blowing through the jasmine in my mind. Summer breeze makes me feel fine, blowing through the jasmine in my mind.
Aruba, Jamaica, ooh, I wanna take you. Bermuda, Bahama, come on, pretty mama. Key Largo, Montego, baby, why don't we go? Jamaica, off the Florida Keys. There's a place called Kokomo. That's where you wanna go to get away from it all. Bodies in the sand, tropical drink melting in your hand. We'll be falling in love to the rhythm of a steel drum band. Down in Kokomo, Aruba, Jamaica, ooh, I wanna take you to Bermuda, Bahama. Come on, pretty mama, Key Largo, Montego, baby, why don't we go down to Kokomo? We can make it fast and then we'll take it slow. That's where we wanna go. Way down to Kokomo. Martinique, that Montserrat mystique. We'll put out to sea and we'll perfect our chemistry. By and by we'll defy a little bit of gravity. Afternoon delight, cocktails and moonlit nights. That dreamy look in your eye, give me a tropical contact high. Novocaine, I keep it coming so I feel no pain. I tell my girl that I'ma change my ways. She knows I'm never gonna change. Same old shit, running my mouth until she busts my lip. So many problems, you can take your pick. I know I'm never gonna change. I am what I am, I know what I know. I'll let you down if you let me too close. I am what I am, know what I know. If you catch me running away, then you'll know. I can't change, 'cause you can blame it on my left side brain. I should know better, but you know, I know, I ain't ever gonna change. Got no shame, spent all my money soon as I got paid. I should know better, but you know, I know, I ain't ever gonna change. Wonder why the party's over soon as I arrive. Must have done something in a former life, and I don't really wanna change. I am what I am, I know what I know. I'll let you down if you let me too close. I am what I am, know what I know. If you catch me running away, then you'll know. I can't change, 'cause you can blame it on my left side brain. I should know better, but you know, I know, I ain't ever gonna change. Got no shame, spent all my money soon as I got paid. I should know better, but you know, I know, I ain't ever gonna change. Change. Am what I am, know what I know. I'll let you down if you let me too close. Am what I am, know what I know. You catch me running away, then you'll know. I am what I am, know what I know. I'll let you down if you let me too close. Am what I am, know what I know. You catch me running away, then you know. Am what I am, know what I know. I'll let you down if you let me too close. Am what I am, know what I know. You catch me running away, then you know. I can't change, 'cause you can blame it on my left side brain. I should know better, but you know, I know, I ain't ever gonna change. Yeah. Well, I got no shame, spent all my money soon as I got paid. I should know better, but you know, I know, I ain't ever gonna change. Change.
I envy the cup of coffee that kisses you every morning. That pillow caressing your cheek when you are tired and yawning. I'm jealous of the steering wheel you wrap your hands around. That seatbelt's on your chest, here in your heart holding you down. I envy the cup of coffee that kisses you every morning. Oh. Ooh. to get to you. I walk an ocean to get to you. It's unfair cause I'm missing you way too much. I'm missing you way too much. And I'm wishing you were right here because I'm missing you way, way too much. And I know that it's so silly of me, all these stupid things, but I'm missing you way too much. I'm missing you way, way, way too much. And it's unfair. Am I crazy to wanna hold you like the clothes on your body? Ooh, I would trade places with the air that rushes by you so softly. Whoa, yeah. I would jump over the edge for you to get to you. Even your coffee is closer than I walk an ocean to get to you, yeah. It's unfair cause I'm missing you way too much. I'm missing you way too much. And I'm wishing you were right here because way, way too much. And I know that it's so silly of me, all these stupid things, but I'm missing you way too much. I'm missing you way, way, way too much. That you got the things I need, but they're always out of reach. That I always have to dream to get you next to me, and it's unfair. Even the stars that shine get to see you at night. It all reminds me of you, and maybe that's the reason why I'm always missing you way too much, yeah. Too much. We're right here because I'm missing you. To be jealous of, but I'm missing you, yeah. I'm missing you way, way, way too much, and it's unfair. And it's unfair. Yeah. Said I'm missing you way too much.
Well, good morning, good afternoon, or in some of our cases, good evening. You're joining us from all over the world. I'm Ken Elmore, and I have the wonderful pleasure of moderating this back to school meeting. It is the 21st of July, and it is 8 p.m. Eastern Standard Time. We are focused in on our good friends from Sargent College today, and particularly, we are going to be talking about the Back2BU Campus Life Guide. And we know that we've got a few folks who we need to engage from a school and college level, as well as looking at dining, housing, and also student health. I want to remind folks that tomorrow at 1 p.m. Eastern Standard Time and also at 8 p.m. Eastern Standard Time, we also have a couple more of these sessions. At 1 p.m., it'll be an open session for all schools and colleges. And then at 8 p.m., Wheelock College, Hospitality, and the College of Fine Arts. So what I want to do momentarily is give a few opening remarks, and then I'm going to pull some colleagues in from around the university. And then we are going to answer your questions. I encourage you, and by the way, those questions should be as they relate to Sargent College and also the start of school, as you may know from the Back to Campus guide that you may have been able to see online or that you might have downloaded the PDF for. So before we begin, I think I'd be remiss if I don't start the way that I've started a number of these. On my walk over, I saw flags at half staff here at the university, and I was pleased to see that we celebrate John Lewis. John Lewis, so some of you know, we celebrated here at the university as the commencement speaker a few short years ago, but also John Lewis, the great freedom fighter in America. I will say to you, I probably would not be standing here today, and many of us wouldn't be in this room if it were not for the truths and the witnessing that John Lewis gave to us. So I'm pleased that we are celebrating him. So the university's made some commitments designed to mitigate the spread of COVID-19 and also to support the well-being of this community and your well-being as a student. A number of the commitments range from regular COVID-19 testing to limiting the density of people in our buildings. And we will see some of the descriptions of those and hear some of the descriptions of those over the course of the evening. As a student who'll be on campus, living on campus, working on campus, and going to classes on campus this fall, you and I, we all have a critical role to play in minimizing the transmission of COVID-19 within the university community. So the university is requiring that you make your own health and safety commitments in the way that the university has with some infrastructure and other commitments. And I'm going to talk a little bit about what those are. And if at any point you're unable to meet these commitments that I mentioned, the university will expect you to remain off campus and complete the semester remotely. If you don't take this step for yourself, the university will prohibit you from participating in in-person campus activities, including classes and living here. Here are the expectations that the university has for its students come this fall. We expect that you'll follow all university health requirements, including wearing a face cover or a face mask, physical distancing, and also hand washing and sanitizing. The university will expect that you complete a symptom attestation every day. And that'll be prior to going to campus if you live on off campus, I should say, or if you are resident on campus before you leave your room. And if you report positive symptoms, you'll be expected to respond to the BU medical professional who contacts you for follow-up, including following any instructions regarding testing for COVID-19. And if you are required to undergo testing as a result of reporting positive, you'll be expected to remain where you live and minimize the contact with others until a negative test result is obtained. We'll expect you to schedule testing and report to an on-campus BU testing site for asymptomatic surveillance testing. And you'll hear more about what that is in a moment. And that asymptomatic surveillance testing is based on an assigned test frequency, which you will obtain. And if you're informed by BU medical professionals or by your own primary care provider that you have a positive result from a symptomatic or asymptomatic testing, and you live off campus, you'll be expected to isolate where you live. And if you live in on-campus housing, you will be moved to an isolation housing unit and you'll isolate there. And you'll hear more again about what that entails. And in order to leave isolation, return to campus, you've got to be fever-free and symptom-free for 72 hours without medication, and 10 days must have elapsed from the onset of your symptoms. Now, if the university determines that you are a close contact of any one individual in the university community who's tested positive, you'll be expected to follow the university's directives to quarantine for 14 days. And we will talk about quarantine, I guarantee you that. And if you live in on-campus housing, you'll be moved to quarantine housing and be quarantined there. We'll give you details. And if you live off campus, you will be expected to quarantine at the place where you live for 14 days. Please also understand that this is all based upon public health circumstances, as well as directives from government, both local and state, and in some cases federal. And university guidance and protocols that you hear will likely change. And one of the things I've noticed with COVID-19 is sometimes that those changes happen abruptly. And we hope that you'll keep yourselves informed and follow the protocols that I've outlined. So that's what we've got. Now, what I'd encourage you to do, if you have questions, to please use the Q&A function. And I will be looking at the questions and I'll try to group them together and get to the spirit of as many questions as I can. I've also got some colleagues who are on here who will also do their best to try and answer some of your questions as well in the Q&A. Okay, so with that, why don't we go ahead and bring a few folks in and we are going to start asking and answering questions. Peter Smikowski, go ahead and introduce yourself.
Good evening, everyone. Peter Smokowski. I am responsible for campus housing and campus dining and a number of other services that support Boston University students, faculty, and staff.
And Provost Kennedy.
Hello, everybody. My name is Sue Kennedy. I'm the Interim Associate Provost for Undergraduate Affairs, and I work with all the schools and colleges to help them think about undergraduate academic programs.
All right, Dr. Platt.
Hey everyone, I'm Dr. Judy Platt, and I am the Director of Student Health Services here at BU.
Thank you. Dean Orsman.
Hi, I'm Gail Orsmond. I'm the Associate Dean of Academic Affairs at Sargent College.
And Dean Moore.
Hi everyone, I'm Chris Moore. I'm your Dean. I am super excited to be welcoming you to Sargent and look forward to seeing you.
Very good. And you should know, oh, let's see, and Amanda, I see you there too.
Hi, I'm Amanda Connolly. I'm the Associate Director for Student Services in the International Students and Scholars Office, and I will do my best to answer our international student questions tonight.
You've got the trickiest job here tonight.
Someone's got to do it.
All right. We have got a number of folks who are also in the event that we've got some questions that require a little bit more specialty. All right, well, Dr. Platt, it looks like we're starting with some questions about, as you can imagine, your big question, and that's quarantining. People want to know if I am an out-of-state student, especially in one of those places that might be considered a current hotspot, or if I'm an international student, will I have to quarantine for 14 days, and how should I schedule that?
Well, let's start off with the tricky questions right off the bat, although I agree mine are less nuanced than Amanda's. The question of quarantine is really an important question. And I want to make a distinction between quarantine because really there are two types of quarantine. There is quarantine that is travel-related quarantine. And as Dean Elmore mentioned, that is quarantine that there may be a state advisory or even a countrywide advisory that anyone coming from an area where there is sustained or widespread transmission, that there is an advisory for those people to quarantine for 14 days after arriving from travel. And this has nothing to do with the person's individual health practices. It's just really a location-based travel quarantine. The other type of quarantine is quarantine that someone gets placed into or is advised to be placed into if they are identified as a close contact of someone who is a positive case. And that's actually a little more straightforward. The travel-related quarantine question really relates to, as we know, people are coming onto campus now. So in Massachusetts, the travel-related advisory is that anyone traveling in areas outside of New England, New Jersey, and New York is advised to self-quarantine for a period of 14 days. And we recommend that here at BU as well. Self-quarantine really means minimizing contact as much as possible and really only leaving your living quarters if it's to get food or have testing or go to medical visits. And
you would do that at home?
Absolutely, that's what you do at your own home. So that's what we need people to be thinking about when they are coming from those areas that are designated as hotspots. We will encourage you to quarantine for 14 days and to actually be even a little more proactive, because we're going to be doing testing here once students start arriving to Boston University. Start thinking about how you can quarantine before you even come onto campus. The more you minimize contact, at least physical contact with others, the better chance you have of not testing positive when you arrive here on campus and then needing to go into isolation. So it really starts even before the travel period, minimizing contact. A negative test is not required to come onto campus, but certainly we will be rolling out very robust testing for students once they're here. And we urge you to plan your travel so that you'll be able to minimize contact once you arrive here on campus.
All right. So let me go, I'm just gonna go right through the queue here. What happens if a professor or a graduate student tests positive?
Shouldn't have muted myself so quickly. So that's a great question. And actually, I want to point to the fact that while I oversee student health services, the way that we are approaching COVID is really from a unified university health services perspective. So All the things that we're going to talk about tonight mostly are more focused on students, but it's the same for our entire community. So faculty and staff will also be part of regular testing. If someone tests positive, and that's regardless of whether you're a faculty, student, or staff, testing positive means that you need to go into isolation. If you reside here on campus, that isolation housing will be provided for you. If you're off campus as a faculty, student, or staff member, then healthcare professionals from BU will contact you, provide you information about what this means, and then check in with you regularly during that time period so that we can give you advice and information about your symptoms as you go through the isolation period. For the most part, isolation is not something that you need a test to come out of. Isolation is really, release from isolation is really done based on a symptom-based strategy. So depending on when you were diagnosed and when your symptoms start to resolve, health professionals will help guide you so that we can have you safely come back into the community after the isolation period is over.
All right, Dean Moore, Provost Kennedy. I got a couple of questions. Let me start with one. When will we learn more about how we will be attending class in person? And there's multiple questions here. Will there be certain days that we're allowed to go to classes? And will rooms be at full capacity?
Sue, you want to take that?
Sure, I'll kick that off. We are working on that even as we speak, trying to put together this puzzle that is the fall calendar. Classes will not be at full capacity in the sense that you were used to it in previous semesters. So the rooms are going to be de-densified. That means that we want to make sure that there's 6-foot distancing between students. Classrooms are going to look a little bit different. So that is, we will have them at what we're calling COVID capacity or de-densified capacity. And the rotations will be based on the class enrollment and the classroom capacity. And we may make some classroom adjustments so that we can reduce the number of rotations, getting students into the classroom more frequently. But that's part of this large puzzle that we're working through.
And I'm going to ask this lengthy question, but I think it goes to the academic calendar and also something specific for human physiology internship. Human physiology internship students were told that they need to complete all 140 hours of their internship before Thanksgiving break because we're most likely going strictly online after Thanksgiving break. So we got to unpack that and make sure we do figure that out. Students used to have 15 weeks to complete all 140 hours, but now they only have 8 weeks to complete the same number of hours. This time constraint means students need to do almost 20 hours a week on top of classes and other commitments in order to fulfill requirements to graduate. Is Sargent looking to reduce the number of hours needed to complete the internship this semester to account for the likely reduced time frame to complete the internship? So I guess the first thing I got to ask Sue is, are we changing up the calendar so that we are finished before Thanksgiving, traditionally Thanksgiving break?
This has been the topic of many conversations, I can assure you, both here at Boston University and at other institutions. I'm sure you've read and heard about practices that the campuses across the country are taking for the fall. At this point, and I believe we will have an announcement this week, we are maintaining the academic calendar as is. That should be what we're working with at this point.
And Dean, does that mean that the internship will stay relatively the same?
So let me say that the first guiding principle, after we assure students' health and safety, our first guiding principle is to make sure that students remain on track for to achieve their academic objectives. Clinical externships present a particular challenge because each externship comes with its own individual challenge. So we'll work closely. We have a whole office of clinical education, and we will work with our academic counselors, with the faculty involved in clinical externships, and with Dean Orsman to make sure that students stay on track without undue burden. So I think part of this question has to do with undue burden, and there won't be undue burden in terms of completing this requirement, regardless of what the schedule is that the university adopts post-Thanksgiving.
Thanks. Peter, and maybe Judy as well, I've got a couple of questions here. Are there any additional housing costs as a student that is in isolation And also, will quarantine rooms be in the same buildings as rooms for healthy students?
Well, there will be no additional costs associated with quarantine and isolation housing on campus. And quarantine units are located, it's an individual unit. So I think Judy can walk us through what a quarantine unit is. It's a private room with a private bathroom. And those units will be fully stocked by the university with all the food, all the beverages, with linen and towels, and some other extras that students will need to be in that space for 14 days. Now, a quarantine student is not positive. It's a student who's had a close contact, but now I'm getting out of the housing business and I'm shifting into the medical business. Since I don't have an MD, I'm going to switch this over to Judy. But essentially, that's how we've designed quarantine housing.
Peter, I appreciate that. I think it shows to the close planning that has been done across many departments at BU as we think about this. So I agree with everything that Peter has presented. Quarantine housing is private room and private bathroom and stocked in the way that Peter said, which is really the most conservative form of quarantine, because most people, if they're traveling and advised to self-quarantine, wouldn't have that same setup. So we're in a unique position here at BU and certainly in some institutes of higher education where we're able to provide that level of quarantine with that level of service for students who end up being identified as a close contact of someone who has tested positive. I want to just contrast that to isolation. Isolation is for someone who has tested positive. And the way that you come out of isolation or quarantine is a little different. But I did see a few questions talking about requiring a test to come out of isolation. And I just want to address that because that was something very early on that was being done in the earlier days of COVID. The challenge with waiting for a negative test until someone comes out of isolation is that the test we are using is a PCR test. And it is a very sensitive, very specific and very sensitive test as well. And it's picking up genetic material. The problem is, even after someone is no longer infectious, they may still be able to be carrying genetic material that's picked up on a test, which has nothing to do with how infectious someone is. So we're following all CDC and DPH guidelines, as Dean Elmore indicated, but some of our knowledge has evolved as we've learned more and studied more about how COVID is transmitted. So I think that's an important differentiation to make.
And Judy, a lot of times questions come up about insurance or additional medical costs associated with this. Can you tell us more about that?
Absolutely. So at least here for BU, in terms of the testing that we're rolling out, which is also important to speak about, we are doing surveillance testing here, or testing of asymptomatic individuals. And that's a little unusual. At least in the United States it is. We have not had large numbers of asymptomatic surveillance testing done. So this is unique because you're not just going to get a test if you have symptoms, you're actually going to be tested on a regular basis so that even people who are asymptomatic or without symptoms can be detected early, given information and advice, and then be ushered into quarantine or, ushered into isolation spaces either on campus or given advice about how to do this off campus if that is the case. There is no cost to there is no additional cost to students for that. We do not use health insurance for those purposes. And if, as Peter mentioned, if students are moved into campus housing that requires additional support for isolation or quarantine, there is not an additional charge for that either. When it comes to health insurance, it's always a challenging topic because there are so many nuances to individual plans. What I can say, speaking pretty broadly for US carriers, is that COVID-related testing and medical care is widely covered. That doesn't mean that you won't have any costs, but that is widely covered if you end up needing to receive additional care at a hospital. The student health insurance plan that all students who are 3/4 time and above are automatically enrolled in as part of the state's requirement to have ACA or Affordable Care Act compliant healthcare, provides coverage as well for COVID testing and COVID-related additional care if that were to be needed.
And here are a couple of questions from off-campus students. Does BU provide supplies for the off-campus student? And then here's another question that fits into that. If a student lives off campus and takes classes remotely, will they have access to the testing apparatus that we have on campus? And will they have access to buildings and other campus resources?
So I'll take the piece around access to testing. The testing is going to be robust and it's for our community. There will be differences in how frequently the community members are tested based on the interactions that they have on campus. So we anticipate that all students should expect to be tested weekly, but we hope to announce more information about the frequency of testing in the next 1 to 2 weeks. For a student who is off campus and engaging in a Learn from Anywhere platform, those students would still be invited to come onto campus for testing. We know that the campus is not surrounded by a gate that no one leaves. We know that our students interact, they mingle, and so we really want this robust testing to be inclusive, again, so that we can reduce the chances of large outbreaks on campus.
So there are a few questions about whether or not we are going to go strictly online for the spring. Is it safe to say we don't know? We are planning for the fall and we're planning for an academic year. Does that make sense?
That absolutely makes sense. I mean, this is a shifting situation, and we will be looking toward the spring, and we'll start looking there. But right now, we're really concentrating on getting the fall squared away, and we'll see how things progress in terms of how things are progressing in terms of hotspot and outbreak across the country.
And I must add that we have to really think a little bit about a number of external questions that come to us. Some of them come as guidance or in the form of guidance from government, as well as what we've been mentioning, a look at what the health circumstances are around us and in the Commonwealth of Massachusetts. Our goal is to complete the semester and the year. Okay, here's a Sergeant question. Can you tell us the extent of hybrid classes concerning Sergeant? And will there be larger lecture formats if we're fully online? How will labs be implemented? Can you give us a little bit more by way of a description?
So Sergeant will be following the Learn from Anywhere protocols the way the rest of the undergraduate courses at Boston University will be conducted. That means some proportion of your courses will be provided via remote instruction. Some proportion will be provided in classrooms. Students will largely have the opportunity to take advantage of the opportunities to be in class when their chance arrives. So not everyone can be in class at the same time. Those protocols are being developed in terms of determining which students are in class on which particular days, depending on their preferences. I will say in terms of Sergeant-specific kinds of activities, we have some unique facilities within the Sergeant building. So for example, the anatomy lab, which many of the undergraduate courses curricula require, that course is supplemented by electronic means so that many of the labs can be conducted very effectively remotely. We have already set up that lab for de-densified instruction. So that course should go on very effectively, as all of the courses should be, but with quite a bit of in-class participation. Other than that, there's quite a bit of variation across courses in terms of how much in-class participation is possible and how much is offered and how much is for clinical skills training actually required. So that pertains primarily to graduate students, and I don't think we have any on here. Gail, did you want to add anything to that?
No, I think you covered it. We're still working out the details and trying to maximize the time all students who want to be in class can be there. And it's a big puzzle. We're putting it together. We're doing our best.
And a student shouldn't be overly worried about lab classes and falling behind, should they?
Not at all. So as I said, I mean, our first priority after health and safety is to keep students on track to achieving their academic objectives. And in some cases, this means addressing each particular cohort's needs within a specific curriculum, trying to make sure that every student in every class is having the experience they expect. So we're working on those analyses right now to take advantage of every square inch of space we have so that we can provide the kind of de-densified education that we really need to do.
Well, let's talk a little bit more about de-densified space around Sargent, in public spaces, communal kitchens, lounges that might exist out there. Can you all talk a little bit about maybe what students might see when they come back and how those might be changing?
You know, so Sargent, so we have already set up the building with de-densified preparations. So many of our returning students will be familiar with Sederberg Lounge, the McKechnie Study Center. Those spaces will be closed off, these communal spaces. We've removed the furniture from those spaces, unfortunately. I know that's bad news for a lot of students who really love to gather there. So we won't be having our receptions there. There's just not a safe way to do that. The hallways and the stairwells have directionality to them, so you shouldn't be passing anyone coming the other direction in a hall or in a stairway. We are implementing protocols for occupancy of the restrooms, so that we don't get overly densified, occupancy of these restrooms. So
well, that's never a good thing.
Sort of squared away.
I was saying overpopulation of any restrooms, never a good thing. So
never a good
especially
thing, no.
now.
Never a good thing. The one thing I will add that has come up frequently is the question of cleaning. So the classrooms and the common spaces are being cleaned frequently, but that means overnight. They aren't receiving, I think it's obvious, they can't be cleaned between classes. So students will need to be very careful about cleaning the spaces that they occupy. Judy can probably say more about that. Anything else I'm missing? So we're working very hard on this space. We're trying to keep people, keep the building sort of minimally occupied, occupied as necessary for classroom and lab instruction.
And Peter, would you add anything to some of the communal spaces that might be around residences or dining?
Yeah, I would. So there will be posted signs that talk about the limits to the number of people that can be in a space. We're not planning on closing these common kitchens, these shared kitchens, but students will be advised to use the kitchens only to reheat or to prepare their food, not to eat there. We will require, I've seen a couple of questions, are face coverings are recommended? No, they're required outside of your living space, your personal room and your sleeping space. So if you are going to be in one of these kitchens, we need to note what the sign says in terms of occupancy and capacity. We need to clean up after ourselves, so we leave the space as we would like to find it. And we will not be able to eat in these kitchens. And then the same thing will be with the common shared spaces and the study lounges as well. So we're not going to close them, but we'll ask students to use their good judgment to read the signs and to leave the spaces they found clean.
Sue, anything you add to that, or Dr. Platt?
I think as you wander around campus, you'll notice differences where there might have been furniture in an open space, in an atrium, that might be reduced furniture. Again, as I mentioned earlier, the classrooms will look a little bit different. They might have seats taped off, or there may be a reduced number of seats. So you'll notice that. We are very conscious of following good public health recommendations, and again, following the guidance from the Commonwealth and from the City of Boston.
And Peter, I'm glad you used the term, use your good judgment. That's going to be an important piece to all of this. There'll be plenty of things that we've put in place, as you can hear, from a structural standpoint, But ultimately, this is about the decisions that I make, you make, we all make in order to do things like observe the number of people that we are recommending or requiring in a space, keeping our face covers handy and with us at all times, and also trying to make sure that we are thoughtful about what our habits are and what our interactions are, keeping physical distance. These are all the sorts of things that we need to make good judgments for ourselves about. There's not going to be any of us there all the time at your arm, holding you back, pushing you forward. So that's an important piece. Judy, someone is raising the notion that I mentioned, that when a residential student has a positive COVID test, they'll go into quarantine, and in order to come out of that quarantine, that student must be fever symptom free for 72 hours and at least 10 days from the onset of symptoms. Now, this person raises the question, being symptom free doesn't guarantee that a student is not COVID free. Shouldn't they continue to be in quarantine until they have a negative test result, no matter how long that is?
Glad that question has come up. It provides an opportunity.
And that's a question that only comes up as sergeant. Let me just tell you.
It provides a good opportunity to talk about quarantine and isolation. Just to reiterate that piece, Peter knows this probably better than I do because we've been talking about it for so long. But quarantine is reserved for people who have been established as a close contact or because it's a travel-related quarantine. Those are not for people who are symptomatic. People who are symptomatic will get tested, and people who test positive will be in isolation. So it's important, it's a little nuance, but important to just be aware of that. And I think, to the concern that we talked about with testing, and how often someone should be tested and should they be tested to come out of isolation, the guiding principles from the CDC, from local and state public health, is that testing to come out of isolation is not required. We know that actually positive tests can last for some individuals up to 4 to 5 weeks, and that is not an indication of infectivity. And so that's a really important piece because we learn new evidence every day, but I think the viral particle being detected versus viral particle causing infectivity is important, right? Some of our colleagues and some people that may be on the town hall this evening have looked at the New England Journal study about how long the virus lasts on surfaces, right? And that's important. We're doing this work, but if a viral particle is on a surface, how we determine infectivity is still something that we're working on as we look at viral, the dynamics of viral transmission. So I'm maybe going off a little tangentially here, but I think there's a lot that still remains to be known. However, there is a good deal that is known, and we're basing that on the plethora of evidence that comes out really daily in the medical literature and in the public health literature related to COVID. So while I perfectly appreciate that symptom-free doesn't mean COVID-free, the most likely time people, at least from what we know, the most likely time where transmission will occur is in that pre-symptomatic period when the viral load is thought to be high, right before symptoms develop, and that's within a few days before symptoms develop, and then when someone has symptoms. Once symptoms start to resolve, and as Dean Elmore mentioned, it's been at least 3 days that symptoms are resolved, people are fever-free, and at least 10 days since the onset of the diagnosis was made or the onset of symptoms, the chance of infectivity then is thought to be very low. So I hope that didn't confuse it anymore, but that's particular to isolation. And isolation is you've tested positive.
Thank you. So here's something about the interplay with professor testing positive. So if a professor tests positive and a student's been attending in-person classes, will all the students in that class have to be tested as well? And I guess this is just about that interplay between student testing and faculty and staff testing.
So that's a really great question, and I'm glad it's come up. Peter and Dean Moore have talked about the de-densification process across campus, and really there's been obviously several goals in mind, but it's to eliminate that possibility of a close contact. So all of this de-densification is aimed at doing that. you will not be engaging in classroom learning in the same way that you had before. So if I am in a classroom and a professor tests positive, the chances that you've been in close contact with that professor should be fairly low. However, we know that it's important to do individualized interviews and do contact tracing with an individual to determine if there was a period where someone was a close contact. And a close contact is currently defined as being in close proximity at least 6 feet for a period of at least 10 to 15 minutes, or someone sneezes on you. Either one of those gets you into the close contact category. So we know that some suite mates sharing an apartment style suite may actually not have had a chance to be close contacts, depending on when someone became symptomatic and when they tested positive. So it's really more nuanced than just saying one person tests positive, the whole classroom has to go into quarantine. That's not something that we think will need to be done, but we will take the individual circumstance into consideration, how long the person has been in the classroom, how frequent the contact was, and we'll really apply that close contact tracing to determine how quarantine needs to happen after someone has tested positive.
Well, Dr. Platt, here's a question I know you are going to love. What are your thoughts on when to get a flu shot?
Oh, I'm so happy to hear that question.
See, that's your favorite question.
That's my favorite question. No, these are all wonderful questions. So in general, getting a flu shot is usually thought to be most effective if you do it sometime around Halloween, right? That's guidance from CDC based on when the typical onset of flu season is. So October is a really good month to think about getting flu shots. And we will be running flu clinics. There'll be physically distanced flu clinics, but we have plans to really increase our capacity for flu clinics because, as many of you are aware, the symptoms of COVID are broad and they are general, and they mimic those symptoms of standard viral illnesses, of things like strep throat and mono, and certainly of the flu as well. So while getting the flu shot obviously is not going to prevent getting COVID, getting the flu shot is a way to reduce your chance of getting the flu, a way to reduce potential transmission if you are a carrier of the flu virus, and certainly will hopefully help to decrease your symptom attestation being positive when you're filling that out each day. So I would say October is a great time. And September, late September is usually the earliest time that we start offering them, and we start prioritizing students who are in clinical settings, because often in the healthcare settings in the hospitals, there's a desire to get flu shots a little earlier. But look for more information. Our website has a whole calendar of our immunization clinics as well as the flu clinics.
So Chris, here's one I think you like. Are professors still going to be having office hours?
Of course. They may not. First, I want to say how great it is to be among Sargent students again. I've missed you this summer. It's so cool to hear those questions and know you don't get academic credit in health science for living through the time of COVID. Aside from that, so yes, absolutely. Students will be having office hours. They are likely to be remote office hours. We don't have appropriately large spaces for a lot of extended one-on-one meetings. But many faculty and students both are finding that these one-on-one Zoom meetings are very effective and provide the kind of interaction that you're looking for with your professors. So yes, absolutely. Faculty will be having office hours and advising sessions.
Dr. Platt, I got to go back to you again. So I get a few people saying, I'm still unclear. I'm coming from one of those hotspot places in the United States, which is fast becoming all of the United States, but I'm coming from one of those places. Do I need to arrive 2 weeks early to quarantine or not?
So I think if it's not clear, it's because I probably haven't made it clear. And we're hoping to release more guidance about that self-quarantine that is advised on behalf of the state with travel-related guidance. I would encourage people to travel by private car when you are able to. And I would encourage people to quarantine as much as possible prior to coming to campus, because all of those individual health practices will help reduce the risk. But in terms of when you come onto campus, especially if you're a residential student, will you need to go into designated quarantine housing? The answer simply is, and it's not different for BU than it is for many other universities and colleges in Massachusetts, we won't have enough quarantine housing to be able to quarantine thousands of students. So we're going to urge you, in the same way that the state urges you, to follow self-quarantine guidelines, minimizing contact with others, minimizing the trips out of your room, and really leaving to get food, to get testing, and to do medical visits. So the easy answer is yes, you'll be urged to self-quarantine when you come to campus. The more nuanced piece, which we hope to provide more guidance on soon, is around, specifically how you'll do that. But I think there's no question in my mind in terms of being able to follow those health practices that really minimize interactions, which is what the point of self-quarantine is in this situation.
Amanda, there are a few folks who are asking a little bit about whether or not you can put some context on what's been happening in the last 2 weeks and how that might affect them as students here.
Will do my best. So this has been, I think COVID in general it's caused a lot of challenges for specifically our international students in terms of mobility. Can you get here? The biggest questions we're hearing from our new students, our incoming first year transfer students who may not have enrolled at BU before, is can I actually get there? Can I actually show up? Is that possible? And then the question we're getting from continuing students is, can I continue to keep my SEVIS record open, where my I-20 comes from? And if I'm outside of the United States for too long, does my visa remain valid? And so we actually have sort of a different set. We have a more complete set of information for our current students than we do for our incoming students. There's still some unknowns for our brand new students who are joining BU in the fall. For our current students, as long as you are continuing to enroll full-time, and as long as you are continuing to make progress in your academic program, we should be able to keep your SEVIS record open. We should be able to, your visa should still be valid. We have lots of questions about 5 months, the 5-month rule. And thankfully that has been suspended. So if you're outside of the United States for more than 5 months, as long as you're enrolled full-time, these are our keys for our current students, enrolled full-time, making progress in your academic program, your immigration record should be able to remain intact. Whether or not, if you're outside of the US, you can physically return to the US, that answer is gonna vary depending on where you currently are. If you're in China, it's going to be a lot harder for you to get back to the United States right now because there is a travel ban in effect. So that if you've been in mainland China for 14 days, you can't return to the United States till you've actually been out of mainland China for at least 14 days. But if you're coming from Turkey, there's not any kind of travel restriction. Now, what you're going to struggle with is potentially being able to find a flight that brings you to the United States. Flights are hard to find right now. So for our international students, there's sort of layers of challenges that could differ depending on where you're at in your program and depending on where you are in the world. But if you are in the United States, you should enroll, try to come back to campus. If you're outside of the United States, we would continue to enroll remotely or encourage you to enroll remotely, and we should be able to have you return to the United States as soon as possible. We are updating the ISSO website really regularly, so check for information there.
Thank you, Amanda. Sue, I've got like 3 questions, rapid fire here. Ready? All right, so is it true that 70 to 80% of students are planning to return to campus?
We did a survey and we did not get a full 100% response from our undergraduate students. We got about a 60% response rate, and of that 60%, roughly about 75% indicated that they intended to return to campus.
And do we know how many of those students might be on campus but still continue to take classes remotely?
That was a question as well. 5% of that group, again, indicated that they were going to take classes remotely, and there was a number, about 15%, that was unclear as to what they were going to do. But again, in the LFA framework, there is that flexibility to do so.
And you see, you can probably see there's a question here as to whether or not LFA is available in the spring.
Again, we are not yet planning for this spring. We're thinking about it. LFA would certainly be able to continue on into the spring if that is indicated, again, by what's going on with public health guidance.
And libraries, will they be available for people to study and to research in?
The libraries have had a reopening plan, and they too will have de-densified areas. So we may see removal of it. So there will be some study space in the library, probably not as much as you're used to, but there is some guidance on that. And I would take a look at the Back to Campus guide, which I think will be updated as well with specific library information.
Thank you. So we've got a few questions that I think go to, there are two things I want to talk about, and then we're just going to try and go around the horn real quick. I want to talk a little bit about the household idea and the concept. So Peter and Judy, if you can talk about that. And then we want to talk a little bit about enforcement, how we're going to enforce all this stuff that we're talking about. And I'll jump into that conversation. So Peter, Judy, can you talk a little bit about the household concept?
Sure. Well, why don't I get us started? So we have de-densified the residence halls. There are no quads or triples with the exception of hojos. And in each residence, we have created this household concept, and it's really not that different than a normal academic semester. Students come with your suite mates, your flat mates, and if you're in an apartment style residence where you have a private en-suite bath, then you always work together as a household to schedule the use of that bath for daily hygiene visits based on everyone's schedules. And there's an understanding amongst the group that we will keep the space clean, or in some cases, maybe not. But in this particular scenario, absolutely, positively, we need to keep that space clean. So we'll count on households in those apartment style and suite style units, the students living in them, to keep those spaces clean. In the residences for first year students and for some sophomores, those residences do have shared facilities. So they do have shared bathrooms. In those residences, we will break those floors down. So a floor at Warren Towers would likely have 3 households, and those households would range in size from 10 to 14 students. And those students would work together with their floor as a collective unit to schedule their daily hygiene visits. Those bathrooms have been outfitted with disinfecting wipes. They will receive deep cleaning during specific shifts of the day by our facilities group. And again, the golden rule applies. You use a common shared space, use the disinfecting wipes to wipe down the space before you use it, the sink, the area, the shower area, and then as you're leaving, do the same. Leave the space as you would expect to find it. But I realize now I'm on the disinfecting soapbox, so I'm going to get off of that for the moment. Move-in has been very—
pardon that pun, right?
Move-in's been very carefully planned in terms of over a period of 2 weeks, from August 15th to August 31st. And the move-in density each day is being scheduled by students based on their preferred time in a morning slot or an afternoon slot. We will require students to be tested on the day they arrive, and hopefully Dr. Platt can touch on that a bit. So it's a very slow scale up and ramp up as we head into the first day of classes. You know, we're ready for you to come back with the acknowledgement that that may not be for everyone. So if you do have a residence license agreement and you're currently contemplating what you're going to do, we have extended your ability to terminate that agreement to August 1st. So you have some time to think about it. I think you can hear, and you can certainly read in the guide, all of the work that we've done to prepare for your arrival. So you've got a choice to make, and we will certainly support either choice.
Judy, anything you would add to that?
I think I would just touch on the piece that Peter mentioned about testing. You know, I spoke a little bit in the beginning of the session about surveillance testing or asymptomatic testing, which the whole population will engage in at BU, and is a regular cadence of testing to be able to determine if will have infections even without symptoms. But Peter also mentioned for the residential students, testing being tied to move-in. And that is really important to touch on as well. And entrance type testing, or the testing to get a sense of what's the prevalence in our community at one point in time, is something that will be done for the entire community that's coming onto campus. But as Peter mentioned, move-in has really been planned with a lot of thought and detail so that students can come in and be tested, and then rather quickly have results from their testing, because we are planning for a 24-hour turnaround time for test results. And I know there's a lot of news every day about COVID coming out, and something that we're hearing a lot about now is the significant delay in the time to receive even an appointment for testing, and then much less getting those results. So that's one thing that I think I really feel proud that BU took the initiative to stand up our own testing facility early, so that would not be a concern that we would have.
And are we going to look at any sort of way that we communicate statistics or information, dashboard, some people will call that, to the campus community?
Absolutely, Dean Elmore. And many of you may already be familiar with this, depending on where you're currently living now. Many states are putting out public metrics for a variety of reasons. Some of it is to raise awareness, which is the same reason that we'll do it here at BU. And some of it is to also be transparent about what's going on our campus. And that feels really important to us as well. So you'll be able to get information about no personally identifiable information will obviously be shared on the dashboard, but it will be aggregate data so that we can get a sense of how many cases on campus do we have, how many tests are we doing, what's the % positive rate of the tests that we are doing. Again, all with that goal of having shared awareness and transparency about what's happening on campus. I think I'd be remiss if I did not say we should expect to have cases on campus. In fact, doing the robust type of surveillance testing that we are doing, by which we are testing people who are not symptomatic, we are going to have positive cases. The goal of all of these measures, the de-densification, the daily symptom attestation, supportive isolation and quarantine, and contact tracing for our BU community, is all geared towards being able to bring the campus back safely, but also to mitigate those risks that would lead us to an outbreak that would then shift us back into a situation where we would have to remove the residential campus. So I don't have a number to say, when we hit this number, this means this, but I do think it's important to realize that we will have cases, but our goal is to prevent an outbreak.
And let me speak very briefly about what most people would call enforcement, or dealing with those conflicts that are going to happen amongst each other. In the same way that we're going to have cases, we're going to have conflict with each other. There's some things that are going to be non-negotiable from the university standpoint. You'll have to be tested, and you have to test as the university asks you to test. And we will have ways that we can follow up with you to make sure that happens. And if you're chronic about not fulfilling our request for you to test, then we will ask you to go remotely, to not be on campus. The other thing that's a non-negotiable is attesting to any symptoms that you might have on a daily basis. Again, we will have some way that we would be able to follow up with you on that. So those are relatively easier ways that we can touch base with you and say, you've got to do these, or the result is that you can't be here. The other thing that we'll be able to follow up with you on is whether or not you are following through when you're on campus. Any quarantine requirements or isolation requirements that we have. We'll be able to figure that out. And so we can hold folks accountable for that. Here's what's going to be harder. And here's where everybody's got to play a part in this. It's going to be much harder, and there are going to be far more conflicts about people putting their face covers or their mask on, far more conflicts about you washing your hands and sanitizing after you use a space. Far more conflicts about more people being in spaces where there's a posted number of people who should be in the place and should not be in the place. And there are going to be far more conflicts about the level of physical distancing that we have with each other. I am hoping that one of the ways that we solve those conflicts is that we talk to each other, that we say, can you please pull your mask up? Can you please give me a little more room? Or to be able to say that to each other, mask up, please, or face cover up, please. Give yourselves a little bit more room, one person at a time, please. Those are all important. We need immediate follow-up on those sorts of things, and we need you to use your good judgment about those things. We keep using that word, judgment. It's important. And certainly, if you were chronic about not following through on some of these sorts of things that I hope that we can adjust with each other, then I will be the person who will have to follow up with you. And that would mean that I would ask you to go remote and to not be here on campus. But I really hope that those aspects of living with each other and those conflicts are the sorts of things that we can work with each other on to nudge each other and to be careful. Now, here's this other piece that's going to be really important about that. There are going to be times when I'm not on campus and you're not on campus, when you're going to be through the city of Boston and socializing with each other. It's going to be really hard for you to do it then, and you're going to need to do these same things when you're not on campus and your deans and your professors and administrators aren't looking at you and pushing you, and other people are finding it easier in the campus environment to do these sorts of things. So this is going to be a bit of a give and take. And the enforcement's going to vary depending on, first off, the level of risk and things like testing, things like attestation, things like keeping quarantine and keeping yourself in isolation. Those are key and important. The other key and important aspects of this too are face covering, sanitizing, washing hands, respecting physical distance, and respecting capacity in places. All important too. But those are going to be a lot more of us contacting each other, at least visually, and making sure that we follow up with each other. So that's a word on that. So here's what I want to do. We are coming to the end of this hour, and we said we'd do an hour. I want to go around to each one of you and ask you to talk about one question that you feel like you get asked a lot and you just haven't had a chance to answer here today. All right? Let's see, Amanda, let's start with you, please.
So I think one of the sort of general questions that we're getting is not so much a question, but just for our international students, general confusion and anxiety about what their reality in terms of returning to the US is. We are waiting for some additional information from the government to help guide how all of this is going to look for our students for the fall. So I would encourage you to really pay careful attention to emails that come from ISSO. Right now, we're going to be sending out updates to you via email as we get them. We're going to be updating the ISSO, so bu.edu/ISSO. We're going to be updating that really regularly as we learn more. So I would just ask that you pay attention and really read the stuff that we send you over the next several weeks, because things that we tell you via email and on our website, we hope are going to, we are hopeful they'll make you feel a little less concerned and a little less confused about all of the things that are happening right now for our international students in the world of immigration.
Gail?
I don't have a lot to add. I think I'm most often asked about how often will I be in class, and we already addressed that. We're working on it. So I just would encourage you all to stay safe, stay patient, and trust that we'll get there.
Peter?
Well, we get a lot of questions about what the dining experience will be like. So I just want to give a shout out to the Sargent Choice Nutrition Center and Stacy Zawicki and her team. We work with them on a regular basis. If you have a nutrition requirement, an allergy, there are 7 registered dietitians, nutritionists, very highly trained. We work with them regularly in dining to help put students on the right path for the nutrition they need. And our chefs, our culinary team has been working tirelessly through the summer. We have a new menu program going out in the fall. I've seen some notes around, well, we're only serving meals in boxes. Well, we do have to serve meals in takeout containers. That's just the safe way to do it. There will be reduced seating in the dining halls. There will be seating available, both singles and seating for small households. But again, that will be reduced. You will get a full, robust dining program. The menus are well designed. There will be a lobster night. We won't be cracking shells this year, but we will have lobsters. There will be a lobster night. You can expect a robust but different experience.
Thank you. Dr. Platt.
I think one question that I'm not sure we had any time to answer tonight is just what happens when you're in quarantine or isolation. And this is true for any member of our community. We are going to reach out to you as the public health, as the medical health professionals at BU. So please answer your phone, answer your texts. I would put that underneath wearing facial coverings, hand washing, and physical distancing. Answer your phone. That's really important for us to be able to contact you. And we will work with you through telehealth visits and telehealth communications to make sure that we can provide support during the time when someone is in quarantine or isolation. So you don't just go to a room and then you don't hear from us. We're in contact with you on a regular basis.
Thank you. Sue.
I think most students are really curious to know what their learning experience is going to look like. And we've talked a little bit about the rooms and they're going to look differently. I think faculty are excited to be teaching you again. And they're thinking really hard over the course of this summer about how to teach effectively in the context of LFA, to really incorporate the students who are sitting with them in the classroom, as well as those who are joining remotely. Thinking hard about how to make those two groups speak to each other and to have robust in-classroom interactions and remote interactions. So it is going to look different. And I think a lot of the panelists have reinforced that across the evening. It will look different. You may not get into the class every single class meeting. You will rotate through, but we're thinking hard about making that work and making sure that nothing is lost in there and that you make your progress toward your degree.
And Dean Moore.
So I'd like to just sort of take an amalgamation of some of the really excellent questions that I've been sort of scanning in the Q&A channel. I think the thing that students should have confidence in, and I hope you get a sense of it this evening, is how hard people are working to make sure that you're safe and healthy in this very tough, world that we're living in at the moment, and that you will continue to make the academic progress that you anticipate. Those objectives are paramount, and a lot of people are working hard to make sure that those things stay front and center. The other thing I want to talk about is that the educational experience that is enhanced by co-curricular and extracurricular activities will go on as we had anticipated from our Sargent activities. Those activities won't look the same as before, but there will be those activities going on. We're still working on many of those speaker series and things like that. Some of you that anticipate having contact with patients, our clinics are under a completely different set of protocols now. You may not have the experience with patients that you might have anticipated, but we still have other ways that we have been able to advance our clinical education. I mean, really remarkable work is being done so quickly in telehealth, telemedicine, remote health provision, mobile health. So we're getting just a really fast lesson in those, and many of you will be exposed to some of these really remarkable technologies that are emerging. So, it's a terrific time to be at Sargent, actually. I mean, the education that we all get in this, when you go into Dr. O'Keefe's class and she starts, telling you what epidemiology is good for, you will know. So it's actually a terrifically exciting time to be in healthcare and a time for us to be proud, to be part of Sargent. So I appreciate your time tonight. Thanks for being here. Ken?
Thank you, Dean Moore. So I'm going to ask all of first I'm going to thank all my colleagues for joining us, and then I'm going to say get out of the room because I want to make room for David Joseph from the student government to come on in. Student government played an integral role in making sure we carry this out tonight. And so I see David in here in the space.
Hello,
David,
hello.
go ahead and introduce yourself.
Absolutely. So my name is David Joseph. I'm a rising junior here at BU. I'm currently studying economics, and I am your student government vice president.
And tell us a little bit about the New Normal Challenge.
Absolutely. So the New Normal Challenge, it's something we've been working on in partnership with the Dean of Students Office, with Innovate at BU, and with Umoja, the Black Student Union, all together combining ideas to put forth a platform that students are actually able to submit their own ideas, projects, works, anything that they want to see implemented on this campus. And if they want to be either on their own team or like working with their partners or doing anything of the sort, they're able to do that. There's 2 different tracks, and you can either submit the ideas directly, or there's a second track, which the kickoff date for that track is July 28th. So it's coming up, please. I recommend everyone to just check the website for more information. You can also look at BU Student Gov. For Instagram, we also have LinkedIn, Facebook as well, our website, because everything is coming and there's a lot more information there, as well as on the Innovate at BU web as well.
Well, thanks, David. And we'll make sure to post that website at the end of this as well.
Thank you so much.
So a big reminder to everyone, tomorrow at 1 p.m. Eastern Standard Time, we have an all campus. Anyone from any school or college could come ask some more questions. And tomorrow at 8 p.m., Wheelock College, the School of Hospitality Administration, and the College of Fine Arts at 8 p.m. Eastern Standard Time will be here. So again, like many of you and many institutions in the area, we're guided by public health advice and government directives. And so that's a bit of what we've got here. And so when you hear about regulations, rules, practices, planning, requirements and expectations, and some of the advice that you've heard today for the fall, it'll be updated and revised as we receive information from health and government. And, you know, I hope I can reiterate, everybody has said it. We want to make sure that we provide an environment that enables you to live here and to learn here, and that this is a safe place, despite a pandemic that might be going on. So wish you all the best. I look forward to seeing you. We will be here ready for you with open arms. We won't hug you because we can't do that yet, but hopefully we will soon. And let's hope that we all can get a little bit of global health, racial justice, and some peace. All the best.